But I'm happy today that we have agreed, and I think the patients can breathe a sigh of relief, because now that means that once affected, where we work as clinical officers, the procedures that we do render, we will be able to render to Kenyans, and so Kenyans are the biggest beneficiaries. So we have agreed that with the Social Health Authority, that the facilities will be empaneled and contracted, and we as the practitioners will be given our pre-authorization rights following empanelment, which is supposed to happen immediately. And I appreciate the Ministry and the Council of Governors because they have given their commitment to fast track the completion of the CBA, and also that now we can jointly be able to ensure that by the time the contracts for the UHC come to an end, they will be absorbed as had been agreed upon, and also to deliberate and ensure that also the internship is streamlined, because we have been having hiccups with posting of internship, I think, for the past 3-4 years, where most of the time the interns have to get to a point where they even have to demonstrate. And I think we can be able to agree on how that can happen in a seamless manner, so that they do not have to wait for more than 1.5 years.
And we have captured in this agreement that there will be no victimization of whatever nature. Mine is just to urge the healthcare professionals. We recognize the importance of human resource for health in the wider scheme of things, in as far as healthcare is concerned, and as far as successfully delivering universal health coverage is concerned. We are at a critical stage where we are rolling out SHA, and every new system has teething problems. And we want to, together with the national government and all healthcare professionals, navigate through these challenges and deliver a healthcare system that works for Kenyans. At the council, we are willing to negotiate, to talk, to put ourselves in your shoes within the reality of our state of the economy, because a lot of these things also have got to do with resources. I'm not saying this only for the team that's here, but just for all healthcare workers out there. We value you, we respect you, we need you, you're indispensable, but please, also, let's see how not to disrupt services for the Kenyans that are suffering.
Having agreed and executed this agreement, the union has made decision to call off the strike, and our members are advised to resume duty immediately and not later than the next 24 hours. We do not celebrate when we obliterate laws or change direction in terms of what we desire. But also, on the specific matter of the social health insurance, where we have been seeking for pre-authorization and empanelment, as the law stipulates, we must say it has taken 6 months for us to be here, and we know that the people who are suffering are Kenyan. And of course, the desire is to ensure that we increase accessibility. So we are the majority clinician who offer services to Kenyan. Every time we are not functioning properly or well engaged, so there will be a lot of noise. That we have been here so long, where we sign agreement and they are never implemented. The same issue of SHA, last month we agreed, and someone somewhere sat on the agreement and decided not to implement, subjecting the Kenyan to 23 days of suffering when we are on strike. That should not happen. And we encourage that we must be able to follow the law.
What we have signed to is something that should have been done a long time ago. Maybe there was, government and bureaucracy. We should avoid so much of that. But we also want to appreciate that The union has also been magnanimous enough. We know you are under pressure, but the most important thing is engage and engage and engage. Like my chair has said, we are a listening government.
My ministry remains open to ensuring that the needs of both healthcare workers and the public are met and or addressed in a timely manner. I reaffirm my commitment to the public to ensure that quality, affordable, and accessible healthcare services reach all individuals in line with the government's pledge to leave no one behind.
You have, they have a room, you can use this one.
No, me, mine, I'm not saying.
Oh, you're not saying. Okay.
The others have been signed also by the CEO.
Unajua nimesaini mahali mbaya. Ah. Moja hii ikae. Hold this.
Yes.
We need a copy because we sign another place. Because hii nimeisaini ni mahali mbaya. Your Excellency, kijana wako amekusalimia sana. Unamjua lakini? Ako na msichana wako. Ni rafiki yangu sana. You sign all page.
But you'll have to bring us together. Imewekwa level 4, but most youths do it at level 3. So for those with their own facilities, now they cannot do, because it's considered a minor.
Because we have sent this, and you should be empaneled.
Yeah.
Then now we need to.
We come and sit down. Okay.
Hatuwezi acha gap already ziko.
Siwezi kuamini kama hujasaini. I cannot believe you. And we call it Kenya Annual Health Workers Convention. Hii mambo tukiwa wote COG, ministries.
Chama. Sasa huko kwako iko kitu yangu na kwamba angalia ilipitishwa mwezi wa 5 last year.
Kuna time nilikuwaga
Sema knowledge.